So next administration thing, and kind of again on this theme of regulation, right? We had FDA, we talked about HIPAA and FERPA. We also have the Occupational Safety and Health Administration. Now this should not be something that is unknown to you. OSHA, we've been talking about OSHA since you were sophomores and maybe freshmen in first aid CPR. But OSHA is actually a lot more than what we think of it as. So OSHA is really about setting safety standards and regulations to prevent work-related injuries and illnesses. And so they have kind of two branches. They have the branch that creates the standards, and then they have the enforcement branch, which is the fact that they can implement fines or prosecution for non-compliance of their device or of their standards. Many states have departments that work with OSHA. So not only do you have federal OSHA, but you usually have your state level as well. So we most often think of OSHA with bloodborne pathogen training, right? That's the part of OSHA that fits into our job description a lot. So the fact that you have to recognize that your employees are at risk for bloodborne pathogen exposure. You have to encourage universal precautions, right? That we assume every individual has some sort of disease, so we're always going to protect ourselves anytime we could be exposed, and having the proper equipment around to do that. Employers also have to have exposure control plans on file. So what happens if you are exposed? Who do you report that to? How do you get medical care? All of that needs to be followed with the exposure control plans. And that has to be an annual in-service. So as much as you love watching our videos and doing that bloodborne pathogen training, you're going to do it every year. And if you're practicing as an athletic trainer or any healthcare provider, you're going to do it every year. It's just part of the gig. It's what you have to do. But OSHA is way more than that, okay? OSHA has to do with how you handle chemicals. So, you know, we have chemicals that clean our whirlpools, that clean our tables, you know, how those are handled, what to do if you're exposed to one of those. It also does rules on safety of the workplace. So non-skid floors in wet, do you have to put out signs when the floor is wet? So think of everyone using the cold tubs and how wet that gets. We should have, you know, signs out there warning about that safety. Again, OSHA is about the workplace, so it's about your safety in that environment. You know, so there's lots of things that fall under OSHA, and any of them, if found non-compliant, could result in fines, prosecution, shutting down the clinic. So it's an important thing to keep in mind.